I'm going to move on to our final presentation. This is going to be given by Becky Ness. When we were deciding what the theme of this program would be, we were discussing how cancer patients have just a plethora of resources. Sometimes you're actually bombarded with resources and information. And we spoke to Becky, and Becky's a licensed clinical social worker who works with individuals and families that are impacted by cancer and infusion, medical oncology, and radiation oncology settings. And Becky works at the Northwestern Medicine Cancer Center in Warrenville as the lead social worker. And what she's going to talk to us about today is how to identify what resources you need and then how to connect yourself with those resources. She provides coordination for the social work team, and she's going to talk about getting the help you need as a cancer patient and as a survivor in this sea of resources that we have available to us. Thanks, Becky, for joining us today.
Thank you so much for having me. Okay, so it's kind of going to be a little bit of a information bomb, but hopefully we can get through all of this together and give some folks a good starting point as to where they can go and find some of these resources or figure out kind of their starting point with things. So I kind of title this like common concerns and resources for new patients, but there are certainly a variety of resources that can help patients in their post-treatment life or as they're moving through the continuum of cancer care. So one of the first things that patients and their families can think about is, how are we going to break this news? Who are we going to tell? How are we going to do that? So if we're looking towards telling our family and friends, really honestly, give yourself some time to process your feelings following the diagnosis. Give yourself that space to really kind of absorb and see how you're feeling and take temperature with yourself about what your thoughts are, and just kind of try to recenter yourself. Consider who is going to be a positive support system for you. And what I mean by a positive support system, who's going to be your go-to folks? Who's going to be there driving you to treatment or helping you around the house, picking up your medicine, making you meals? Who's going to be that positive kind of person that can help you through your journey? Many times that is an immediate family member or friend, and usually people think of breaking the news to them first, because those are going to be your tribe, so to speak, to help get you through this cancer journey. And also, you want to consider, how much do you really want to share? And I think for everyone, it's a little bit different, right? Do you want to get into the details with everybody, or do you want to keep things a little bit more superficial for the extended folks? So, maybe acquaintances, workplace friends, extended family, maybe you're not so tight with, and then be really kind of letting those people that are going to be there going through this with you in on the know, and what your treatments are and kind of the nitty-gritty of it all. A lot of times when individuals share their cancer diagnosis, they can get overwhelmed and bombarded with well-meaning people who just want to help. And it can be a little, although it's lovely, it can be a little overwhelming for the patient to have to field all of these calls and text and social media messages, depending how you decide to share, and can be really overwhelming because you're consistently then sharing the news and having to process that again. So sometimes it might be nice to establish someone who can kind of be your point person, who you can kind of refer back to. Again, maybe one of those, positive support system folks. You could be like, hey, your job in helping me with all this is kind of keeping the others at bay. She's, I can only get through the day. I can't get through everyone asking me about my day, and kind of using that support system to kind of push people off a bit in a nice way so that you can really focus on yourself and your healing and your journey. And kind of conjunction with that, you can think about establishing a website. Caring Bridge is a very popular one where you can kind of blog about your cancer experience, how your days are going, distribute news that way, so that your friends and family can get referred to that website versus calling you or messaging you all the time. And it kind of creates a little bit of like a barrier so that you're not feeling like you're getting hit on all sides from very well-meaning and loving people, but just that can be overwhelming in itself. Now, specifically, if you have children, teens or younger children, there can be a lot of different feelings about what do I tell them? How much should they know? And it's been in my experience that it is very important to tell your children that you have cancer and to be honest as to what cancer is. Children are very clever, regardless of their age, except for maybe our little itty bitty ones. And so they can pick up on cues, or we think we're really good at hiding things from them, but we're not. They can tell when mom or dad is just really not feeling well, or that they're acting a little bit different. And not telling them can lead to anxiety and fear. And they can really internalize that. Did I do something? Is mom not doing well because of something that happened with me? So really kind of being honest with the kiddos about what you're going through in a developmentally appropriate way. And I'll kind of talk a little bit more about that in a minute. Now, although I think it is important to tell your children about your cancer diagnosis, I think it is okay to delay telling them until you have more information, such as what's the extent of your disease or what the treatment plan is. Because historically, children understand best when they have the whole picture presented to them instead of bits or pieces. So you can tell them, dad is going through cancer treatment. His treatment looks like he'll be going to the doctor's office every, 2 or 3 weeks for an infusion or to get his medicine. And you might notice him not feeling so well. Maybe he won't be able to play as much, but he's still going to be around. And this is how these appointments are going to look and how dad's going to feel. Kind of giving that whole picture perspective instead of as things pop up. For our younger children, it's kind of nice to provide reassurance that cancer is not contagious and that they didn't do anything to cause your cancer. And so don't also be surprised if the conversation is very one-sided. Some children may not have much of a reaction or have many questions. They're processing things. They take their time to kind of think through and see what their questions are going to be to you. And so I wouldn't be surprised if after the fact, after a couple of days, they come back to you for further clarification. So in my experience, it's always been good to tell the children when you have all the information that you need to share with them. Now, I talked a little bit about telling them in developmentally appropriate ways. And my favorite book to kind of reference back to is The Simple Talk for Tough Times. I'm going to go ahead and open it up here. And what I like about this book is that it really breaks down how do you talk to children about cancer. And it really goes through the developmental age groups, such as infant to 2-year-olds, some things to consider. And then it goes also regarding, what to say, some more ideas on language to use, kind of some ways to break this news, as well as what to watch for. So when are some of these behaviors concerning, and maybe we need to get additional support for the children? Okay, I've also included some additional links here for some really great resources from the Yale Cancer Center, HuffPost, and cancercare.org regarding some additional books and some additional resources on helping kids if they want more information, things that are at their age level, ways that they can process this. Now, another thing to consider is how do you tell work? Many individuals are want to, need to, or able to work during treatment. So how do you disclose to your workplace that you have cancer? Some things to consider if you want to disclose is it might be that treatment side effects may lead to missing work and impact your productivity. This may lead to some cons, of course. They'll be discussing about your performance at work. They've put on a performance plan. So those are some things to consider if you are working, that treatment side effects could impact your ability to work. So you may want to disclose that just so you're not getting in trouble. Other things to consider for disclosing at work is that many workplace benefits, such as reasonable accommodations or medical leave, requires you to have disclose a medical condition in order to access those things. And you would also want to consider, the culture of the workplace as well. What's your relationship like with your coworkers? What's your relationship like to your boss? Is this a big workplace where maybe they don't have that close knitness, which might be nice because then people won't be super involved perhaps? Or is it a small workplace where you're like a family, and kind of your level of trust with your work? And I included a photo of an organization called Cancer and Careers. They have free downloadable materials. This is the manager's kit, and it gives you ways to help communicate with your manager or your boss about your cancer diagnosis and what your workplace rights really are. So this is a very just kind of brief overview. We could have a whole conversation just alone on this, but having a cancer diagnosis could qualify you for a reasonable accommodations for your job through the Americans with Disability Act. So reasonable accommodation is something that the workplace can put in place, either a change or an adjustment to help you be able to continue to perform your job duties. For example, people can request working from home, a modified work schedule, an additional leave of absence, and so on and so forth. It's not a guarantee that your workplace will honor this accommodation request, especially if it's going to cause undue hardship for the employer, meaning it might cost them a lot of money or really kind of cause a lot of reorganization. And it's not also asking for a different job at your workplace. Other workplace benefits that you might want to take advantage of, and again, this can be used for active treatment or sometimes in some instances, depending on how you're feeling post-treatment as well, is family medical leave or FMLA. And that is covers a up to 12-week unpaid job protected leave for family or medical reasons. And so our caregivers can take advantage of this as well. And as a lot of people are familiar with this with maternity or paternity leaves, that's the 12 weeks off that you can take after the birth of a child. So it's the same type of leave. This leave of 12 weeks can be used continuously. So you can take off that whole chunk of time, or a lot of patients choose to use that intermittently, meaning that when they're having off days or they're not feeling so well, they can take that day off and have it deducted from that 12-week period. And so it kind of extends those benefits. It's also something that's offered through work. Sometimes is a short-term disability policy, and a lot of times that can be used concurrently with the FMLA. Since the medical leave is not a paid leave, some income would come from the short-term disability, and that really varies based on the policy, which varies based on the employer benefit package. And usually there is a period of time under 6 months that they consider that short-term disability. That's average. There's some that are less, some that are more, of course. And if we're still not able to fully return to work after short-term disability, then they would transition you to what they call long-term disability, which is typically a slight pay reduction. Again, it depends on the employer benefit package. And many of these policies work in conjunction with the Social Security Administration. They want you to apply for those Social Security benefits with the long-term disability. If you want to move forward with applying for any of these benefits, it's best to work with your HR department or whoever the person is that handles these benefits. And I've included some great resources that kind of help further the conversation about choosing to disclose and what your workplace rights are. Cancer and Careers is fabulous. They do a lot of really great semi-annual conferences where you can get a much deeper dive into FMLA and disability. I highly recommend them. Triage Cancer has some really great handouts, free and downloadable, regarding how FMLA and some of these other benefits work. If you would like a job accommodation or want have to start the conversation about a job accommodation, the JAN or the Job Accommodation Network is fabulous and gives you a lot of really great starting points on how to request those things. And the Cancer Legal Resource Center. So if you feel like your legal rights, that you're not able to access these benefits or that you're being discriminated against because of your cancer diagnosis, the Cancer Legal Resource Center takes a little bit of time, but they will connect you with some legal aid to help with your case. And then the Department of Labor Help is the U.S. Legislation or department that oversees the FMLA, the Family Medical Leave Act. So obviously we know that there's emotional changes that can occur following a cancer diagnosis as well. Cancer diagnosis is a life-changing event that can cause psychological and emotional distress. Feelings of depression and anxiety are very common during this time. And there's estimates that 15 to 25% of people diagnosed with cancer will also suffer from depression, where estimates up to 20% of people may suffer from anxiety. And caregivers may experience anxiety and depression as well. It's really hard to see your loved ones going through this. And traditionally, anxiety and depression are at their highest peak following that diagnosis, kind of like, okay, we have cancer, but we're waiting to do something. You know, we're waiting for treatment. We're waiting for these final scans or these final tests to come back to know, is it chemo, is it surgery, is it radiation, is it observation? What is our next direction? And as time passes, or once we know what the next step is as humans, that makes us feel a little bit more grounded and centered, and we can kind of learn what to expect in the ebbs and flows of when is our like good days, when is our not so good days, and kind of help us prepare or plan. So let's talk about just a tiny bit more about depression. So what is depression? Depression is feelings of sadness and or loss of interest in activities you once enjoyed. It can be just feeling worthless, decreased concentration, just feeling really tired, and maybe even thinking about death or suicide. Really, you're just kind of in this hole and nothing seems like it's going to help to get out of that, or we don't see a way out. And there's also some physiological or body symptoms of depression, unintended weight loss or gain that's not due to treatment, not sleeping well or sleeping too much, changes in your energy or fatigue that's not due to treatment. And depression is different than normal sadness. You know, everyone gets sad, not everyone gets depressed. So depression is really when these symptoms of the feeling of overwhelming sadness, that we've lost interest, we're not engaging with anything that we used to like or love before, and it interferes with your ability to take care of yourself. You're not eating, you're not showering, you're not getting out of bed. That's when we worry about depression. And there's a link here to the Mental Health America, which is a wonderful, great resource as well, where you can do a self-assessment. You can take this as many times as you want. You know, if we're feeling not so great, how, you know, what is our depression level? And this kind of gives you that tool so you can kind of track, is this something that we're struggling a little bit more with? And then anxiety. Anxiety is a normal reaction to stress, and it can be beneficial. However, when it becomes a concern, when these normal anxious nervous feelings impact our ability, again, to do our daily living activities, and it is excessive, it is kind of sitting with that sicky feeling in your belly where it's just unease, or there's fear and there's dread of the unknown, and you just can't stop feeling like hypervigilant, or kind of can't stop feeling like there's something bad that's going to happen and you can't stop thinking about it. Physiologically, we look at, do you have fast heartbeat, nausea? Are you feeling shaky or dizzy? Do you have a hard time concentrating? Do you feel like your throat is closing up a little bit? Those can all be signs of anxiety or panic. When we can't stop thinking of the negative thing and it's causing us to kind of ramp up worst case scenario after worst case scenario after worst case scenario, that's anxiety. And I included again a self-assessment for anxiety through that Mental Health America. So how do we treat depression and anxiety? Medication-wise, antidepressants help relieve depression and symptoms. It can also be useful for anxiety as well. However, something to keep in mind is that this can take a few weeks before it becomes effective, because what it does, or what many of them do, not all of them, but they impact the neurotransmitters in your brain to kind of help regulate the depression. And anti-anxiety does not cure anxiety, but it can provide relief of symptoms. It can kind of help our mind cool off. And so really those are best discussed with your medical team, whether it be your primary care, your oncologist, or a psychiatrist, which is a doctor that specializes in this type of medication. Also, you could do counseling or what we call talk therapy. And what that does is it helps you identify these negative thought processes or what kind of triggers you into a depressive or anxious episode, and be able to identify that and develop some skills to utilize to help it not overwhelm you or not take over your life. And counseling occurs either on a one-to-one or in a group setting. Most insurances cover some form of counseling, or there are cancer support centers kind of scattered throughout this greater Chicagoland area that offer some of this for free. I want to highlight briefly that hair loss is a big emotional difficulty for a lot of our patients, and can be as I said, one of the most distressing side effects. So something to kind of help a little bit is to know what to expect. Not every chemo results in hair loss, number one. So it's a good question to ask if you're doing a chemo teaching or having a chemo education with your provider. Is hair loss expected to occur or not? And also know if hair loss is expected to occur, doesn't always mean just the hair on your head, but it could be hair on your body, be your eyebrows, your leg hair, your nose hair. It could be more than just the hair on your head. And hair loss doesn't typically all happen in a snap of your fingers. It can be a little progressive with time. At least it is for most treatments. Again, better to verify with your physician. But hair loss, it might just be thinning to start, and then the hair loss happening as you get more and more chemotherapy. So a lot of patients, or something to consider, is take control over that hair loss. And some people get like a short haircut before starting treatment, or even shave their head before treatment. And so they try to do these things just because it can be a little bit more, we're not going to let cancer tell us how we're going to feel and how we're going to do with the hair loss. We know it's going to happen. So let's take some power and control back. We're going to do this our way. And it can also kind of help you get adjusted and used to how you look. It could be less distressing, getting a shorter haircut or shaving your head preemptively versus just seeing that hair fall out over a period of time. And it also can help with wig fitting. There are programs that have free wigs. And so sometimes with less hair on your head, it's easier to get a better fit with the wig and what's going to look right on you. And also get support. There's a lot of support groups out there, and talking with other patients about how they coped with hair loss and really validate those feelings. It is hard. It does suck, and you're not alone in those feelings. So as I mentioned, many cancer centers have mental health professionals that can assist with managing complicated emotions. You can certainly talk about it with your medical provider. Some of the cancer support centers that offer that free counseling support group things are the Living Well Cancer Resource Center, who is an organization that I'm affiliated with. And we are out in the west suburbs of Lawrenceville and Geneva. The Wellness House has services in Hinsdale and Chicago. There's Gilda's Club in Chicago, the Cancer Support Center in Mokina and Homewood, so it's the south suburbs, and then Waterford Place in Aurora. And a lot of these agencies offer a variety of free cancer support services, from counseling, support groups, free wigs, to yoga, exercise, and with the COVID-19, a lot of the platform is virtual. So it's totally fine to use services from every single one, whatever fits your need and your schedule. And I know I'm kind of running low on time, so I apologize. I'm going to just keep going if that's okay with everybody else. One of the biggest concerns we get from patients when they start treatment is, what am I going to do about money and about insurance? So something that people consider is Social Security disability. And these are disability benefits through the federal government. And you have to qualify for these disability benefits. And to qualify, you have to have worked enough and paid enough into that Social Security, pay enough in Social Security taxes. And you cannot be gainfully employed, meaning you cannot make more than $13.10 a month is the current wage. If you make more than that, you're considered gainfully employed and therefore not disabled. So you have to have the work credits, not be gainfully employed, and also have a qualified medical condition. And I actually included the link here with the list of all the diseases, all the cancer diagnoses, and what qualifies them for disability, because each diagnosis has different qualifying criteria. And so it's really neat to look at what your diagnosis is and if you can potentially qualify, or maybe see if there's a social worker, if they can talk you through that or have a referral for you. Something to keep in mind is Social Security disability is only income. It does not include health insurance, and the income amount varies depending on how much you paid into the system. And once you apply and are approved for benefits, there's about a 5-month wait period before those benefits begin. So if you were approved in January for benefits, you'll see your first payment in June. So it's not immediate. To apply, or if you have questions to apply, you can do it online. That's the easiest and best way to do it, because then you can track your case, and you'll go to My Social Security or ssa.gov/my account and kind of go through the process there. In conjunction with Social Security disability income, which is SSDI, there's supplemental security income, or SSI. And this provides income for adults who are disabled, and you have to meet certain financial limits. And this may be an alternative for those who don't have enough work credits to apply for the SSDI benefits. You still need to qualify medically, and it is a less amount of money per month, but it's nice to know that that is an option. And to apply for this, it's best to contact Social Security directly, and I included their phone number here. We'll make sure all my slides get shared with you guys. Insurance. So let's say you have used all of your family medical leave, and you are no longer protected, your job is no longer protected, and your health insurance is no longer protective. And if you remain unable to work, you may lose your insurance, or you may lose your job, which in conjunction, you may lose your insurance. So there's a program called COBRA, which allows you to keep your workplace health insurance, but you have to pay a higher monthly premium. And I've seen premiums anywhere from $500 a month to $1,200 a month. It really just depends. Many times COBRA is not affordable to patients, especially because they don't have that income coming in that they used to. So they may turn and look for other insurances. One of those is Medicaid, which is the state public insurance. And this has certain income guidelines that need to be met in order to qualify. And it varies state by state. So Medicaid in Illinois is not the same as Medicaid in Indiana or Wisconsin. And Medicaid in Illinois will not cover services in other states. There's also the Affordable Care Act plans, which is law under President Obama, and that has a health insurance marketplace where you can purchase plans and you are guaranteed a policy through them. They cannot deny you coverage due to any kind of pre-existing conditions. How much you pay for this depends on your income. And so what they tend to do is subsidize the monthly costs based off of your income. So if you're at a lower tax bracket, not low enough to qualify for Medicaid, you can get help to lower your costs through the tax subsidy under the ACA, or the Affordable Care Act. And finally, patients always have a lot of questions about Medicare. Medicare is the federal insurance that adults are able to enroll in once they turn 65. Or if you've been getting that Social Security disability income, or SSDI, for 2 years, you get early access into Medicare. And that's a whole topic to itself. So what are the next steps then if you have questions about these programs? If you have questions about Social Security, either the disability benefits or the SSI, the supplemental security benefits, or if you have questions about retirement benefits, the ssa.gov is a great and easy to use website. If you want to see what coverage would look like under the Affordable Care Act, you want to go to the healthcare marketplace, healthcare.gov, and that way you can preview plans and prices. Same with medicare.gov. They kind of go through the ins and out of what Medicare doesn't cover in the different parts of Medicare. If you are a senior or if you are Medicare eligible due to disability, there's this program in Illinois called SHIP. That stands for Senior Health Insurance Professional. And a lot of the county health departments or community agencies have SHIP certified counselors, and they've gone through additional training through the state to help those who are eligible for Medicare make sure that they're understanding their benefits and enrolling all of them. So it's a great place for a lot of patients to start, is just talking their situation through with a SHIP counselor. If you have Medicaid questions, you want to go to illinois.gov to the Department of Human Services. Now, Medicaid is a very nuanced system and not always the easiest to navigate. So you might want to see if there's anyone at your healthcare institution, whether it be Northwestern or outside of Northwestern, what their resources are to kind of help understand the Medicaid process, because there are very strict guidelines for that. And finally, just for some overall good educational information, I'm again recommending Triage Cancer as a place to kind of do a deeper dive on some of these topics. Okay, I did. I'm only 5 minutes over.
Looks like we have one question for you in the chat or in the question box. Can you see it, Becky, or you want me to read it?
Yeah. So why don't presenters mention scalp cooling in regards to hair loss? I had this at Lake Forest and kept about 70% of my hair in my head. That's a great question. So with the cooling caps or cold caps, each cancer center manages those differently. I know, at least for out in Warrenville, until recently, cooling caps was something patients had to bring in and do themselves. That was not something that we offered. We just now started offering Dignity caps at our center. And so I can't speak for other cancer centers, but and I do know that there's a little bit of a process to see if that's going to be the best fit given your treatment and things like that. So it's certainly an option. It's definitely worth talking to your medical team to see if that is something that fits within your treatment plan and the timing of it, because there's very specific timing or guidelines of things. But certainly we've had great success with cooling caps for some folks not as much. But that's kind of unfortunately the hard thing about cancer, right? What works with one patient doesn't always work with the next. So cold caps or the cooling caps are definitely a great question to ask if your cancer center has any resources available for that. That's a great point. Thank you. Yeah. All right. Yeah. Well, thank you so much for spending this evening with me. I just try to give a high level, view on things. So hopefully I didn't overwhelm you guys further with stuff.
No, it was great, Becky. We thank you so much for wrapping us up with this final presentation. And we're a little bit over time here, so I'm going to give us a quick wrap up and just thank everybody for giving us their time and attention for the past hour and a half. I hope you found our theme and our presenters brought a lot of information, good information to your cancer experience. And as always, we thank you for trusting us with your care here at Northwestern at the Lurie Cancer Center. We hope you have a good night. Look for our next program. It should be coming up sometime early next year. And we wish you good health. Good night, everybody.